This episode of Beauty and the Surgeon podcast is brought to you by Let's Get Checked. Let's Get Checked is an online company dedicated to making professional health testing easy and accessible. Let's Get Checked offers fast, affordable, completely confidential at-home health tests from a range of tests from STDs, male and female hormones, and even COVID-19. Listeners of our podcast who are new to Let's Get Checked get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com, trylgc.com/beauty, BEAUTY, and be sure to use the code BEAUTY20, BEAUTY20 at checkout. Do it. Getting tested is important. It's the responsible thing to do, and you know how important I think it is to make sure you understand your labs. Welcome, everyone, to Beauty and the Surgeon podcast. I'm Amy. I'm a nutritional therapy practitioner, and I'm joined today, as always, by Dr. Jason Martin. He's a board-certified plastic and reconstructive surgeon. Dr. Martin, how you doing?
Pretty good. How you doing, Amy?
I'm good. You're looking good.
I'm feeling good. I shaved today.
I know. I think maybe that's what it is, because yesterday, or was it Wednesday?
Or I don't remember.
A couple days ago, you were rocking a pretty good...
I had a beard
pretty
growing.
Good scruff.
Yeah.
Yep. So I think it's different. Like, you're like, whew, fresh and so clean.
I wanted to be all Grey's Anatomy. You know, just got to look some facial hair, some very gruff, and some cool sunglasses on, but wasn't feeling it. Now I'm all clean. So fresh and so clean.
Fresh and so clean. Well, that's good, because we have a very important topic to talk about today.
Yep.
First off, if you are listening to this podcast and you're interested in watching it, it's not a super interesting episode to watch, potentially, because there's only a couple of slides. There's nothing super fun on these slides. But we are on YouTube at Jason Martin, MD.
Yeah, and definitely follow us. We're almost to 1,000. We're getting to swag level.
Yep. When we get to 1,000, you can hopefully buy one of these beautiful Beauty and the Surgeon cups online.
It's going to be a massive haul.
And a shirt with our faces on it. It's going to be a good time.
Just a shirt with Amy's face and my face.
Well,
and
I'm serious about
Nils
the
will be in the
SWAT
background,
ladies.
like those little background Nils.
He'll be on the pocket. Background Nils. Yes. I seriously want the shirt that says SWAT ladies.
Yeah, I like that.
Bench press.
That's a good one.
Yep.
But if you get a shirt, I get a shirt, and now I got to think about it because it's too much pressure.
Okay, well,
So
you
I'll
got like 66 people to think
I
about
got
it.
about a month or two to go.
Yep.
Okay.
All right. So today we're talking all about preoperative appointments, and this is a really important topic, and one we've talked a lot about post-op. We've talked a lot about post-op specifically to procedures. We've talked a lot about recovery. I mean, in fact, we have multiple episodes on recovery specifically. But I was thinking about it, and we've never really talked about why pre-op is important, or what to expect at your pre-op appointment.
Yeah.
I was mixing appointment and important together.
Preoperative or something?
Important and appointment.
Okay, gotcha.
Appointment. So let's first talk about, like, on a very basic level, why you need a preoperative appointment. And this is not related to
why don't you just show up at surgery and be like, hey, man.
Like, here we are, let's just do this.
We talked before. Let's do this.
Yeah, let's just do this.
Like Burning Man, you know?
Yeah. And to be fair, I mean, there are times when we literally meet a person
I'm sorry.
on the day of surgery when we take trauma call, and that's not ideal, right? You don't know much about this person's health history. Sometimes, I think my favorite example of this was the man who was airlifted here to Denver, to Colorado from Kansas.
Such a great story. How much of that can we tell without destroying HIPAA?
We can tell the basics. Okay. A person was airlifted here.
Yep. And he had injuries that were pretty severe, and he wasn't awake.
Well, he was awake-ish. But he was not able to move. His eye was not responding to light.
He was inebriated, very inebriated, difficult to assess.
Yep.
And they called and they said his eye is entrapped, which is a surgical emergency. I went there. Definitely the eye was not moving very well. Difficult to assess him because of his inebriation. So we had to go in and repair. He did have injuries for sure.
Yeah, he had a fracture.
That had to be repaired no matter what. So the surgery was not for naught. But the only reason I did it right away is because we didn't know if his eye was entrapped, which is a surgical emergency.
Explain why it's a surgical emergency.
Oh my God, how did we get from the episode we're on preoperative?
Because this is interesting.
Okay.
Because people love hearing about this kind of stuff.
All right. So the floor of your orbits,
that's where your eye sits.
Where your eyeball sits. There's muscles that go around your eyeball, and that's how they move. If you ever want to get freaked out, go on the internet and look at the muscles of the eye. It's
pretty amazing.
It is amazingly and so damn weird. Yeah. So if you fracture the floor that your eyeball sits on, those muscles can get stuck in that fracture line.
And that keeps the eye from moving.
And then those muscles can start to swell, and they can necrose, and then you can actually lose the ability to move your eye forever and end up with double vision, which is very debilitating. So it's something you have to fix right away. We fixed it. It was fine, but it was difficult. It's always hard to fix a fracture right away when people are swollen. And then afterwards, a couple of days, sobers up, and I went in there and said, "Oh, I'm so happy we fixed this." And when you came in, your eye wasn't moving. He goes, "Oh, that eye hasn't moved for 40 years."
He had a previous injury.
Which, by the way, the guy had no vision in that.
Yep, couldn't see either. So his pupils were also non-responsive.
Yeah, right. So all the stuff that the ER doctors brought me in for, 40 years, the guy had not moved his eye or had vision from it.
Yeah. So
this is a good preoperative talk.
It's a good so the main reason you need a pre-op appointment is to rule out any health issues or contraindications. There have absolutely been times when a patient has had a consultation with us.
Yeah. I don't have any health problems.
No, they come in for pre-op and oh, by the way.
Oh, my diabetes.
Yeah.
I was like, well, I know I asked you like twice. Oh, but I don't give the shots. I only take the pills. I'm like, well, that's a problem.
Right. Or I have normal blood pressure because I take 6 blood pressure medications for it.
Yep.
Yeah, I have a small heart murmur. All these things that people are like, oh, it's no big deal. My doctor once upon a time told me this was no big deal. Mm-hmm. So while that may be the case, or hey, by the way, I'm on blood thinners for the rest of my life, but it's from nothing. I could probably just stop them. Yeah, we don't want to guess about that kind of stuff.
Yeah.
So it's basically to rule out any major health issues or contraindications that would preclude you from being a candidate for the surgery. So it's very important. Also, to review the plan.
Which is like extremely important. Every episode, so whatever procedure you're into, facelifts, tummy tuck, name one, Amy.
Facelift.
Okay, facelift. That's imperative that you have that preoperative appointment because you need to sit down with your surgeon and you need to look them in the eye, he or she, and you need to make sure that he or she is doing exactly what you want, that you're on the same page in terms of the outcome.
Well, I take somewhat of a step in a different direction from that conversation. I think reviewing the surgical plan is making sure that you and your surgeon are on the same plan, not that you are holding your surgeon's feet to the fire and demanding that they do the surgery you're asking for.
That's not what I was saying. Is that what I said?
It is.
Okay. At least your expectations are the same as your surgeon's expectations.
And that's my next point.
You can hold my feet to the fire. I kind of like that.
Understand the risks and limitations of surgery. That is very key. And that's something that a lot of our patients who have had surgery with other surgeons who come to us for revisions or touch-ups or whatever say, my doctor never told me this. Or if they had just told me that this wasn't possible.
If they would have just actually talked to me beforehand and told me how big they were going to go
or that that's not possible to do this.
Where the scar would be or
that even if they pulled really tight, this still would be there. Understanding the limitations with your surgery is key, but the risks also very key.
Yeah, the risks also. The times that I've had, not issues to know so you have problems with surgery, but just really disconnects with the patients is when I didn't spend enough time beforehand really talking about expectations and what I thought I could and could not do with the surgery. A lot of us, and it's not malice, it's not malintent on the patient's part, hear what we want to hear. You pay all this money, you want to have this thing gone. And when in my head, I look at it and I'm like, oh, I can make it 90% better or 80% better. How do you, as the patient, how do you know what that means, right? So in your minds, 90% is like,
you're now a size 2.
All gone. Yeah, you're like a totally different person.
Yes, you're a different person.
You were bigger before, and now you're super skinny with no
You're
fat
also
at
4
all.
inches taller.
4 inches taller. That's just saying a lot since you're a tall person.
I am a tall person.
People don't really know how tall you are.
I know, it's because I sit short.
Yeah.
On purpose.
That's a little hidden secret.
Yep.
Amy is very tall, by the way.
I sit short.
So I think that those times where I've had disconnects with patients, and that's very distressing to me, just so you know. That's a failure on my part. But it's also, as a patient, you need that preoperative appointment to go in there and empower yourself, understand, ask all the questions you need to ask.
We're going to get more into that.
Okay. And just make sure that whatever the plan is from the surgeon's standpoint that you agree with.
Yeah. So these 3 things, if nothing else, you don't have any medical or health issues that make it so you're not a candidate for surgery. You know what you're having surgery on, and you understand the risks and limitations.
Yep.
On a very basic level, that's it. And I think everyone has probably seen and or had themselves a surgery that's on one limb only. Left and or right knee, ACL. You guarantee you that doctor will write either their own name very frequently on the limb or, yes, or they'll write a no on the side that's not the surgery side.
You have to.
Yeah. So because of the amount of people waking up from surgery, having surgery on the wrong leg or the wrong arm or whatever. So, there's a reason to have a pre-op.
Yeah.
So let's talk in a little more detail about what to expect at your pre-op appointment. This is where we can get into all the details that Dr. Marr was kind of getting at. Number 1, sign consents and take preoperative photos. Dr. Martin, the most frequently asked question is, why are you taking my pictures?
I know we kind of feel like it, it's just like, what else? What are we going to do? That kind of thing.
Right. These are part of your medical record.
Yeah. No, I mean, it's like the most important thing we can do. And that's not just for the surgeon's sake as a CYA situation. That's for you.
That's literally the best way to document
for you. So when you come in and you're like, oh, I love this or I don't like this, you have some documentation of exactly what you looked like before. Huge. If you're doing surgery and they don't take pictures, and a lot of them, then you should be concerned.
Yeah. And we've had this happen. A patient comes to see us. They've had many surgeries or several surgeries on something. They try and tell us how it looked before surgery. And unfortunately, we don't know how they looked. So for them to say like, well, this was a bad result, when you don't know where someone started from, it's really hard to judge whether or not that's a bad result. That might be the best result you get. And again, understanding the limitations of surgery, maybe this is a good result for you. And not in all cases. I mean, in some cases you can definitely tell without pictures what a person probably looked like before, but it's important. We also had a patient reach out once who emailed me. She had had surgery with us years before, like 5 years before, and had recently been to a dermatologist who had found something concerning on her back. And they'd asked if she had any pictures that might show this area because it had changed really quickly, at least in their thought. She asked if I could send her pictures. And, they were able to send those to her dermatologist so they could literally zoom in on this spot on her back and see it. I mean, this is your medical record. Like, this is an important part of your medical history. So that's why we take pictures. So how about consents? Why are consents important? This is like COVID question right here.
Yeah, you just go ahead. You go ahead.
I mean, consent is, obviously it's important that you are consented for the surgery you're having.
Yeah.
To protect you, to protect the surgeon, to protect the hospital. It's not okay to do surgery on somebody who has not consented to have that surgery done. It would be considered like abuse. So got to be consented.
Right. And if you can't consent yourself, which you're not, if you can't, you're probably not going to have elective surgery. Right. Then someone who can will. Right.
Like a parent. I mean, we do have patients who are under 18 and do have a parent sign for them. In these cases where we do trauma call and a person might be already intubated or something, they can't verbally communicate, we have somebody who can sign for them. Those things do happen, or they're appointed somebody by the hospital to basically be their voice to do stuff. So there's always somebody who needs to sign this consent in any circumstance, really.
A legal consent is absolutely necessary. It's the foundation of any kind of surgery. So you're just not having surgery if someone's not having surgery unless there's a consent on there that's legal, correctly done. The risks and benefits were discussed at length. It's not like that's consents all of a sudden wipes clean any issues afterwards. It doesn't work that way in the whole legal milieu.
No, it's not an arbitration agreement.
Right,
it's a consent.
Right. So people think, well, I don't want to sign this consent because this is absolving you, the surgeon, of any liability, which is absolutely not the case, just so you know. It's just saying that you guys had that discussion. How it would come up legally, and again, I am absolutely not a lawyer. Nils is, but I am not. How it would come up legally is if some of the issue, if you had issues after surgery and your claim was that the surgeon or the team didn't talk to you about the risk and benefits, and that would raise huge red flags. So at the very least, it does absolve the surgeon, or it does document the surgeon's ability, how am I supposed to say that? The surgeon's
like due diligence?
Due diligence, yeah, in terms of talking about the risk and benefits of any, or really the risk of any procedure.
And that's why the consent is called the informed consent.
Yeah. So
you're informed first.
But we like it just because it brings up all the topics. I welcome it. I like it. I can educate my patients. And then, you bring up certain risks and like, whoa, let's talk about that one. That's kind of scary. And then you work through like how that could happen, why this could occur. It actually brings up good topics. So I don't think you should just brush over the risk and benefits of the surgery quickly when you're with your surgeon. I mean, if there's something pops up that really sounds kind of scary to you, speak up and say something.
And on our consent specifically, we get them from the American Board of Plastic Surgeons, and they list the risks specific to this procedure first, and those are usually rather short. Those might only be a page or a page and a half at the very most. After that, the rest of the consent, which may be 4 to 5 more additional pages, is risks of any surgery. So those are just inherent risks of literally having anything from as simple as Botox to a facelift done. You still run the risks of skin infection, bleeding, pain, injection site issues. Like all those things are inherent to any surgery.
Right.
Facelift, skin cancer. Like, I mean, some risks are risks across the board. Appendectomy, some of the risks of surgery are risks of surgery. So there are going to be specific risks of surgery you're having, and then there's just risks of surgery in general. And those are two different categories, and they should be on most quotes. I mean, on most consents. Those two things should be separated out to make it easy for you to look through and be like, okay, well, the risk of a facelift may include nerve damage, whereas the risk of a breast aug, not so much. Like there's differences there.
Right.
Both are going to have the risk of skin necrosis. Like both are going to have the risk of pain.
Risk of infection.
Yeah, bleeding. Asymmetries, need for additional surgery.
We should just do an episode where we just list the risk of every procedure.
Oh my gosh, go back and forth. That would be a dry episode.
Almost like back and forth until we whoever stops wins. Or like whoever doesn't stop.
You just keep going back and forth with risks.
I'm going to go way out there. Alien invasion.
Right, yeah. Oh, for sure.
Yeah.
Yeah. Abduction.
Yeah.
Okay, moving on. So review your pre and post-op instructions. Now, this is very important. Like Dr. Martin said, you might be looking at consent and be like, wow, I didn't realize that. Like, does that mean I can't do fill in the blank? Yes. Patients come in after surgery. Well, like, I had a facelift yesterday. When can I swim? 6 weeks. No, I need to swim tomorrow. Like, no.
Nope.
Like 6 weeks.
But I need to swim tomorrow, but you can't.
Yeah. And that's why it's important.
We don't waver either. It just drives people crazy. They think if they give us the sad puppy dog eyes.
Like, nope.
Please.
But,
like, no.
Yeah. And that's why it's important to talk about these things, though, because when someone says, when can I exercise again? Well, this is going to be different for someone who does Pilates versus someone who does like competitive fencing. Very different answer to that question. And also varies on the type of surgery you're having. So make sure you go over those things with your surgeon.
Yeah, you wouldn't want to do fencing after breast augmentation.
It'd be a while with any surgery. Oh, tummy tuck. Yeah. You're going to get your prescriptions for medications, pre- and post-op medications.
Yeah. Always, like at your pre-op appointment, remember to remind them of your allergies. A lot of times people will get prescriptions because that's what we normally do. This happens to us. Sometimes we do a standard regimen and the people weren't really, we ask them, do you have any allergies? No, I really don't. And then they remember, oh yeah, this one time I had a rash from this. So make sure that you inform them again.
That's on stuff to bring to pre-op.
Oh, I love it. Okay,
yeah.
good.
So you'll get your prescriptions, most likely. A lot of them might be able to be called in. You might have some in paper, some called in, combination of both. But it's important to know like what's being called in for you so you know to pick it up, all that kind of good stuff. You'll receive orders for pre-op blood work and any diagnostic testing, so EKG, mammogram, all that stuff. Or your doctor may tell you that you need to have those things done by your primary care physician. Either way, somebody's got to do some of those before surgery. Confirm the arrival and start time for your surgery. This is important. It can change. So I always tell our patients, whatever the hospital tells you is absolutely going to trump what I'm telling you now because things change. Things get pushed, things get moved around. If there's a trauma surgery that has to be added on, like you might get bumped down an hour. Always go with whoever tells you the final answer, which is the hospital.
Or the surgery facility.
Yeah, the surgery center.
If it's not the surgeon's office.
Yep, pre-op department. You're probably going to make your final payment to the surgeon. You might also be paying other people at the same time. If you want a really good breakdown of the cost of surgery, we did a podcast recently where we talk about the cost of surgery and break down all the different people you might be paying. And finally, schedule your first 1 to 2 pre-op or post-op appointments. That's usually done at pre-op as well, just so that they're on your calendar. You know when they are. They're on your schedule. You don't want to miss those. Anything else I missed that we do for the patients?
Sometimes we look at afters just so they can see them again, like review what afters look like. If you're getting a rhinoplasty, you kind of get an idea what you think you're going to get in the end.
Yeah, review pictures. I mean, take pictures and review pictures. Yeah. If you're having a breast aug, we're going to size you for implants at pre-op.
Sometimes I'll take your pictures literally at the time of that preoperative appointment and draw on them, especially for facial procedures to show you what I'm doing. So that's really helpful for people because they get a better idea of what they can expect.
Yeah.
And that's true for rhinoplasty.
Yes, it's very true for rhinoplasty. Let's take a quick break. We're going to come back and talk more about what you can expect at pre-op.
See ya.
Dr. Martin, I'm super excited to talk about our sponsor for this podcast, Let's Get Checked. If you've been a listener of our podcast, you know that we have never had a sponsor before, and that's because we're an educational podcast. We're not looking to monetize, and we also would never recommend something that we didn't believe in and or use ourselves.
So basically you're saying we're very choosy.
We're very choosy when we come to our testing, but Let's Get Checked really aligns with our values. We talk a lot about monitoring your blood values of certain things. We talked recently about vitamin D serum levels. We talk a lot about hormone levels, and it's hard for some people to get to a lab, or you're afraid of the blood draw, or just, you're concerned about confidentiality. Like you have a lot of concerns and you just don't do it. Let's Get Checked makes it super easy because it's completely confidential. You do it from your home. So there's really no excuse not to do it.
Yeah, and we did it recently. Both Amy and I did it. She looked at her women's health, basically her hormone levels, and I looked at mine on the men's health side with testosterone. It was very simple. You go online. Their online interface is really easy to use and good. We got the testing kit very quickly. And the test itself, actually doing the stick, you do a stick on the end of your finger, is not hard to do. It only took about 3 to 4 minutes. You put it back in a sealed envelope that's confidential, goes back to them. You get your results in 2 to 5 days. It's really that simple. And the best part is it's about empowerment, about you taking control and trying to do things that are positive for your health and life. And this is one way to do it literally from the comfort of your own home.
Yeah, so they offer a wide range of tests. So they do men's and women's hormone panels. They do a full panel of STD testing. They also are now offering a COVID-19 test at home. So there are a lot of other just basic blood levels that you can get tested as well. And one of the things that we always say is you can't track what you don't check. So you might not know what's normal for you in the future if you're not checking it now, especially as it relates to hormones. And men's health specifically, I feel like is a little bit undertreated. I mean, sperm counts are dropping by a large percentage in men these days. Most men struggle at some point in their lifetime with low testosterone.
And those men do not know what the symptoms of low testosterone are. Depression, anxiety, sleep problems, osteopenia or loss of bone, loss of muscle, and something we treat all the time, gynecomastia or male breast growth. These are real problems that can be improved or treated with testosterone. And these men do not know their levels. It's so easy to get checked. And this is why we're so excited about the sponsor.
Yeah. And Let's Get Checked is a completely CLIA certified lab, the CLIA lab. So they're a well-established, completely safe lab to use. You do get contacted after, so you get your results. I got a text at 4:30 in the morning, which I loved, that my results were ready.
And we're both up at 4:30, so that was good.
Super excited. And you have access to not only a nurse, but also a physician. So a physician does review your results, and it gives you a little breakdown of like where you're sitting on those levels. Dr. Martin's had even comparisons of like where 2 of the levels should be in relation to each other, which is a really important thing to note.
Right.
Just being within the normal range is not always enough. So it really gave more information than that. You'd still want to, of course, reach out to your own doctor if you needed some additional assistance with these labs or you did see something that was concerning. We didn't, thankfully, so that was good.
Yeah. We were both good. This podcast is about empowerment. It's educational. In my private practice, I'm a board-certified plastic surgeon. We are all about empowerment, and this is one way to do it. So we're very excited about the sponsorship, and we're looking forward to using it for our patients moving forward.
Yeah, so as a listener of our podcast, if you're also a new time user to Let's Get Checked, which a lot of you probably are, we do have a 20% discount code. So you do need to go to our specific URL, and it is linked in the description box below, but it's going to be TryLGC, so TRYLGC, like Let's Get Checked.com/beauty, BEAUTY. And you'll need to use the code BEAUTY20 at checkout. Beauty again is BEAUTY 2020. And you can pick a test, like any test you'd like, put in our code and get your test shipped to you. Getting tested is the right thing to do. It's lets you know where you're at and what's responsible.
All right, well, let's get tested.
Let's get tested. Let's get checked.
Let's get checked.
We're back. All right. So let's keep talking about preoperative appointments.
Can I say one thing?
Yes.
Our preoperative instructions are pretty, I would say, awesome. Okay. We've had patients tell us that our preoperative instructions that we hand to them and we tell them are better than what they got with their hip replacement. But that's not always the case at every office.
It's not always the case. I mean, I've seen patients who, when we're doing combo surgeries, will sometimes bring in their preoperative instructions from other doctors, and they're far more like very, very detailed, even in some cases, than what we give. I mean, ours are very, very good, but I think they're also, our surgeries are not maybe as oddly complicated as some other procedures are. Like when we do combo cases with other specialists, sometimes they have like really weird specific things that people have to do.
Right.
I feel like ours are easy to follow. Maybe that's what I'm getting at. Ours are really easy to follow, and maybe that's what people really like about them. I also email them primarily. We like to save paper, so we've started emailing them all. But I mean, if someone wants them printed, I will print them for them. Some people do print them at home and bring them in.
Yeah, I'm sorry.
I appreciate all of that.
I know we don't print them out.
I don't, not anymore. We used to, but
we used to. I'm sorry. Yeah.
Paper, saving paper.
Yeah, we email everything. Whatever the case is, whatever we have for these patients, and that we've worked really hard on it, they really appreciate that. It's not always the case when you go into your preoperative appointment, and that puts you at a disadvantage, just so you know. The best thing to do is be prepared for surgery. That's huge. And this preoperative appointment is like kind of like a time to really assess what you need to do, what to expect, and to get your mind in the right place.
Yeah. I think a really important part of that is the next slide is how do you prepare for your preoperative appointment? So we kind of talked about what the office is going to do when you get there, like the things that the office is going to do. But what should you do to prepare for your preoperative appointment? Ideally, my number one, and I wish more people would do this before they come in, and I do encourage our patients to do this, is review your pre and post-op instructions before you come in. Write down your questions.
That's such an Amy thing.
Well, because a lot of people don't. And then they're very surprised when they finally look at their post-op instructions on post-op day 1.
And they can't do CrossFit.
Yeah, that day.
On post-op day number 5.
Yeah. So it really helps if you can, look at those ahead of time. It's probably going to bring up some questions that we can talk about at pre-op. It's the best time to get those questions answered because it's when you have your doctor's attention as well. So it's a really good time to get those questions answered. And if you haven't looked at it ahead of time, there's no way to do that. So ideally, in my perfect patient world, you would look at those before you come in. Another person who should probably look at those is the person who's going to be taking care of you after surgery. In all cases, you do need someone to be with you for the first 24 hours after surgery or when you're discharged from the facility.
When you have general anesthesia.
Even office procedures. Yep. If you're taking oral medication for an office procedure, you need
Okay,
a
if you're taking
responsible
medication.
party.
I got you.
Yeah. So
I mean, there's some cases where people don't take medication.
those are pretty rare. And even in those cases, I don't want someone to be left completely alone.
Gotcha.
So we still, our pre-op instructions do state that all procedures require someone to be with you for 24 hours.
Okay.
You seem like you don't believe me. You don't think that's necessary?
Our direct neck excision didn't.
Right, but there's times when we've had a conversation with somebody ahead of time and it's a very minor procedure. I mean, if somebody's coming in for a mole excision, we aren't going to make them have a responsible party. Nils, we sent Nils home by himself with a big hole in his head.
I can't believe we did that.
But really, if you're having something done that could at all impair your ability to function,
Yeah, if you're on pain medication, period.
Yeah, then
so you need someone there.
You cannot be. So if that person is going to be taking care of you, it's really nice for them to be able to review those because if not, they're asking you. And you may not be completely able to communicate to them.
And you're trying to communicate with them after surgery.
Medicated.
With medicated and
in pain.
And you're trying to get out of bed and it's hurting and
they don't know how to help you.
They don't know how to help you.
So
yeah.
Ideally, that would be great. Dr. Barnard mentioned this. I'll give you bullet number 3.
Bring a current list of your medications, supplements, allergies, and recent blood work or diagnostic testing, including EKGs and mammograms. Mammograms, by the way, would be for breast augmentations, specifically in people over probably 35.
Or breast reduction.
Breast reduction.
Breast lift. Yeah.
You want to get a mammogram before those surgeries, just for surveillance purposes to make sure there's not something concerning going on.
Yeah, just get a baseline. But bringing the list with you is really helpful because even if it's extensive, and we may not be able to go over it all in detail when you're there, I can at least still have a copy of it, look over it, some point during the day and email you back or call you back and tell you what you need to stop, what you can keep, all that good stuff. If in doubt, just bring them with you. I did have a patient do that. I still remember it was like a basket the size of like old-timey lunch pail.
That's happened more than once.
Yeah, full of supplements.
Yeah.
So I just laid them all out and took a picture of it and looked at it later because it was a lot all at once.
So I'm so happy to have a nutrition therapy clinician, counselor, practitioner. NTP. So some people come in, they're like, I'm on this supplement, doctor. You need to help me with this. I'm like, I got the expert right here.
I'll come talk to you about your supplements.
And Amy knows every single one of them.
Yeah, but also the medications you're taking, just because we went over those medications when we saw you, sometimes that changes. We may not have seen you for your consultation.
Real quick, why do supplements matter, Amy? What can they do to surgery?
So we've talked a lot about this in our podcast episode about supplementation around surgery. Supplements are still very powerful, and they're not necessarily regulated, so they could be very high doses of things that have a powerful blood thinning or anticoagulation effect. Those are the 2 primaries. There's also some that are very stimulative, so we don't want you taking a bunch of stimulants the day of your surgery when we're trying to sedate you. You want to mix your uppers and your downers.
Hey, man, I'm ready to go.
Yeah.
Are you ready?
I just took 3 scoops of pre-workout. I'm coming in for surgery. I'm hot.
I drank my pre-workout. I had 3
got
Red
a
Bulls.
6 pump.
I'm ready to go, man.
Took my nitrous booster. Yeah, you don't want that. So a lot of supplements are going to kind of thin your blood or make you just not clot quickly. So you're going to bleed more. You're going to bruise more. Are you going to die because you didn't stop taking your fish oil? No. But is it going to make for a much easier and more pleasant surgery from the surgeon's standpoint? Yes, when you're not just oozing all over the place.
Yep.
Yeah, so there's a reason for that. And some are very, very contraindicated for surgery, like stimulants specifically.
Have your preferred pharmacy information handy, which I think is extremely important. I know I skipped one.
You skipped one.
Yeah, but
OCD is not liking that.
yeah, I know. But I actually think this is really important because I think starting in January, we're not going to have written scripts anymore.
Yeah, Colorado's
At
going to
least
go
in
to
the state
all.
of Colorado. And I'm sure that's going to be like that in the United States.
Oh, a
So-
lot of states have already gone to it. Wyoming is actually already like that.
Yeah, so you're going to have to give the office your pharmacy information, and they're going to have to send a digital, like electronic script through some sort of monitored system over there. So you should have your preferred pharmacy before you go into that appointment, just for that reason.
Yeah, and even without it, I mean, for me, it's really important because if we are seeing somebody or someone has an issue after hours, if that pharmacy information isn't in our EMR, it's really hard to get that sometimes. Again, from the caretaker, they're like asking the person who's had surgery, like, what pharmacy do you use? And they're like, out of their mind. I'm like, well, and that's why I tell people, like, grab the pill bottle that has their pain medication in it. Well, we're at my house. And this is where the one above this becomes very important. Make sure the office has your post-op caretaker's current contact information, phone number, email, and the address where you'll be staying after surgery. That is so important.
Oh, that's so important.
Because a lot of people don't. And then they're like, oh,
Especially with us, because we get so many people from out of town.
well, you're staying with your significant other, your boyfriend, girlfriend picked you up from surgery, like whatever, and they live, 10 miles away from your house, and there's like 15 different pharmacies. So knowing what pharmacy you like and also knowing what pharmacy is going to be good for the person who's taking care of you, they may be two different pharmacies, and that's important information for your office to know so that you're not scrambling to try and find a pharmacy for a person who, is maybe nauseous after surgery. They're throwing up. You need to call an anti-nausea medication. Well, where are you? I have no idea. I don't even know where I am.
So many patients we call in Zofran, which is a nausea medication.
Yeah.
And, it makes a difference when it's not 10 miles away from your house. So your caretaker can run there,
And get it quickly.
get it quickly.
Yeah. So those are really important things, like knowing who is picking you up, where they're taking you, knowing that you weren't abducted by aliens, because that was covered on your consent. So you're out of luck if that's what happened.
So one of the things, like in tummy tucks, you talk about moving the plates and stuff you use to the lower shelves, so you don't have to bend over or stretch really high. These are all things that are included in our preoperative instructions, and hopefully things that your surgeons will be having, discussions with you with, or their team, the care team.
Yeah. So the one at the very bottom here is don't forget it's picture day.
Yeah.
When people come in and they're surprised, like, oh, you're taking my pictures today? I'm like, yep.
Or you're going to take them naked?
Yep. Don't you have those little things I can wear? No. Nope, it's picture day. So we do, we crop faces out, unless we're taking pictures of your face, so we really do
If I'm
try
doing
to
a
protect
facelift,
your privacy.
I crop the other parts out.
Right.
If I'm doing breasts, I crop everything else out. If we're doing stomachs, I even cropped out the genital area.
Yeah.
So that's
we
what
protect
do.
your privacy as much as possible.
Yeah,
but
we care deeply about that, but you're going to take pictures.
Mm-hmm.
That is for you. That's empowering yourself. So you have definitive documentation of what you look like before surgery.
And there are a lot of people who tell me, as I'm about to take pictures, never show these pictures to me. Or someone asked me, do I have to look at these? No. And we have this screen behind us, if you're watching, is in this room all the time. This is the room that becomes our picture room. And a person actually asked me if when I took the pictures, they were going to flash up on the monitor because they were going to close their eyes.
And then would it be like this voice would come in, shame, and then like the other picture,
know.
shame. It's what kind of people do they think we are?
I know. It made me really sad, but I think that there are definitely offices that do kind of shame people, and that is unfortunate. So your pictures are not meant to shame you. Your pictures are not even a form of judgment. Like, like I said, I crop the heads out of pictures. So when we're looking for somebody's pictures, sometimes, a couple weeks later.
It is crazy, though, how good Amy and I are
Yes.
looking at body parts and knowing who it is.
Right. And like that has nothing.
Like,
and,
it could be years later. I'm like, oh, I think that was,
Oh, and I'm like, no, I know exactly who that is. And it's in a non-judgmental way. So like, this is what I mean. Like these pictures don't attach any emotion to them, because we certainly don't. Like these are part of your medical record and that's it.
Yep.
Like moving on. Now there are other people who are like, oh my gosh, can you send me these pictures? Usually that's for their after pictures. Or that just, they don't want to forget, like, because we forget. And we talk about that a lot in our podcast about
Oh,
if
my
plastic
God.
surgery makes you happy.
That's the other reason to take pictures,
Mm-hmm.
because there will be times afterwards you'd be like, I don't feel like it's different. I don't
Or it's
know why.
worse.
It looks worse. I don't know why I did this. And that's not, you can have a perfect surgery and still have those thoughts,
Mm-hmm.
right? Because you just went through a lot of crap, in some cases, a lot of discomfort. And maybe it was stressful on your home life. We've seen that a lot. Stressful on your job. It's real life stuff. And then afterwards you're like, geez, I'm not sure that was worth it. All you got to do is show the before and after picture, and then all those feelings go away. And that's universal if you do good surgery.
That's never going to make your life better.
No, but it makes it have some sense of,
Yes.
okay, this was
Like I did this for a reason.
I did this for a reason.
This had a
It had
tangible
meaning.
result.
It had meaning.
Yeah.
Yeah, it's not going to make your life better.
No. Which I think, and that is a lot of the times when people feel like nothing's changed, like they say that, but it's really because your mind didn't change. And that's, if you're thinking on, if you'd like to know more about that, go back and listen to our podcast at the first of the year where we talk about, does plastic surgery make you happy?
Oh, no.
No, but maybe. Sometimes the answer, remember?
No, but maybe.
Right. The answer is definitely not.
It improves your self-perception.
Yeah. Oh, no, that's the definitely not one.
It does. No, I thought it was improves your self-perception, but it
In
doesn't
some
make
cases.
you happy.
No.
Yeah.
There were the whole, oh yeah, that's a good one to listen to. I won't get into it now because that was a great study on this. Actual real data. Okay, so the last slide is, what am I forgetting to ask? This is the most frequently asked question to pre-op.
Do you take my ear off during a facelift and put it on the side of the table?
No, I mean like people literally ask that. What am I forgetting to ask?
Oh yeah, what am I forgetting to ask?
I mean, people ask that all the time. And why do they ask this? Because they're nervous. Because they didn't review their pre and post-op instructions. Because they have no idea what they should ask. There's so many reasons why people ask this question. But I think most of them is because they realize that we do this every day and they don't. So that is actually a good question to ask. And in a lot of cases, I say to people, nothing. Like, you brought a great list of questions. You have asked everything you'd ask. You are well prepared.
I get that question a lot too in the initial consult. Like, hey, what am I not asking here? What do I need to know? And I love that question. That shows that, hey, you're showing some humility that you don't really know everything that's going on, but you're inquisitive and you do care and you want to educate yourself. So that's a really good question to ask.
Yeah.
And you should definitely ask that to your physician. If you get the response like, why are you asking me that? Then you should probably not go to them.
Right. Yeah. No, because this question is great. And I'm not saying if you don't ask it that you aren't prepared, but I think it's a great question to ask. And I hear people ask that not only of, they'll ask me, they'll also ask the front desk. When they're leaving, like, is there anything else I'm forgetting, specifically about payment, about time to arrive? The front desk goes over some other basic stuff with them. And I hear people ask that of the front desk too. Like, am I forgetting anything? And that's a great time for my front desk to be like, oh, yes, I don't have your pharmacy info on file.
I asked that one time to the lady at Costco and it didn't go as well.
What am I forgetting? She's probably like,
what am I forgetting? She's the whole store.
Right? Does she say, like, do you have a list? Like, read your list, man.
I was like, I know I'm forgetting something. That's the worst feeling. And then you have
Especially at
1,000 people
Costco.
behind you. I know.
That's why I make a list. Can't go into Costco without a list. It's like death.
I know.
Because you'll leave with a whole cart full of stuff that you didn't need, and the one thing
Which is what happened.
don't.
And I did not come home with the garbage bags, and that's what it was.
Well,
And
that
it
is kind of tragic.
Which is like the one thing you need from
Yes.
Costco. That and like laundry detergent and coffee.
Toilet paper.
And coffee.
Coffee, yes.
Yeah.
Maybe just write those. See, that's why I like Google Keep, because I have like a checklist of a list, like a grocery list, and it saves it. So even if I check it off one week, I can literally just go back through the list of stuff I've already checked off and be like, but did I really get all those things last week? Am I good on all those things still?
You are so over the top OCD.
That's good times. It's good here in my brain.
No, it's not. I mean, I'm not far behind you, but at least I'll go into Costco without a Google Keep list.
Well, you are taking your life in your hands, man. See, you have a credit card with a higher limit than mine. That's all that means. When you leave with an inflatable
That's
raft,
rich guy problems.
right? You got an inflatable raft and an exercise bike and a whole new tool set.
Why'd you get the tent? We have 3 of them. I don't know. It was on sale.
It's on sale. I also got like 3 new mattresses. Yeah. I'll ride
I
on
got
motor.
one of those camping chairs with an umbrella over it.
I've always wanted one of those.
I have too. I have honestly wanted that chair.
I see that in there.
That is such an obnoxious chair. But every time you see someone, you're like, really?
That person is living the good life. That's what I think when I see that person in that chair.
Yeah.
Yeah. It's also what I think when I see the person in the camping hammock, but I have brought a hammock with me camping and I've never used it. So
Yeah, but if you have a good hammock and you're camping, there's nothing better.
See?
The problem is a lot of those the hammocks you get in, you feel like you're getting squeezed in, like literally.
Like a banana.
Yeah. Like a papoose.
You're the inside of the banana.
Yeah.
Yeah. All right. Well, we got way off topic on that one. So the most frequently asked question at pre-op is one you should also ask, and that is, what am I forgetting to ask?
Yeah.
Because it might be something little. You might have not asked really any important questions like, hey, what time should I be there? Or are there risks associated with this procedure? Could be something big, could be something little.
Mm-hmm.
So pre-op appointments, they're important. If you would like to leave us a voicemail, I love your voicemails. You can leave us a voicemail on the number at the screen here. That number is 303-630-9038. We do listen to all your voicemails. If you listen to our episode before this where we answer listener questions, there's 2 voicemails there that were great. They were excellent voicemails. I also love questions on YouTube, any platform really. You can find us on Instagram at JasonMartinMD and at Beauty and the Surgeon Podcast.
Preoperative appointments are a time for you to sit down with your surgeon beforehand. And that's really important. We take it really seriously here, and we don't try to rush people through it. We want them to be comfortable. And I think, just being able to look in your surgeon's eyes and ask serious questions is like the biggest thing. So prepare for that appointment. Empower yourself. That's what this podcast is about. It's about empowerment. The reason why we go through all these darn surgeries is so you can learn about them. So when you go into these appointments, you already know what you're doing. The preoperative appointment is the time for you to really sit down and get those questions answered. I like that speech.
That was very good. Then just rewind and remember that I told you should leave us a voicemail and a comment, a rating, review.
Right. And definitely subscribe to our YouTube channel.
Yeah. Thank you so much for everyone for listening. And we hope to see you here. Hear us here.
See you in here.
Hope you hear us here next time.
Hope you hear us, see us.
Next time. Don't forget to check out our sponsor, Let's Get Checked. Let's Get Checked offers fast, affordable, and completely confidential health testing for everything from STDs, male and female hormones, and even COVID-19, right from the comfort of your own home. And remember, new customers and listeners of our podcast get 20% off by using our URL, trylgc.com/beauty, and be sure to use the code BEAUTY20 at checkout. That's trylgc.com/beauty and use the code BEAUTY20, beauty, BEATUY 20 at checkout. Get checked. It's the right thing to do.